Hi class, Dr. Jim here. In this lecture we're going to be looking at a system that you probably don't think much about but is actually very important to your body, and that's called the endocrine system. Now the endocrine system is a series of glands that you have that regulate and release these chemicals called hormones. And hormones are chemical messages that are sent to various cells that turn things on, turn things off, and really kind of maintain your body's homeostasis and basically regulating whether you get too warm, too cold, have the right blood pressure, the right amount of glucose in your blood, things like that. And so there's a lot of different types of regulation that this system actually does in your body. And so we're going to take a look at some of the various glands, the major glands that actually play some roles. We're also going to discuss some of the hormones that are involved in these things. And again, it's more about a general understanding of what the system does today that we'd like you to look at. And again, we're not going to ask you to memorize all the different glands and all these different things. That's more of a strict A&P, but there's definitely some questions that we'd like to ask again about some of the structure, function, maybe where you'd find some of these glands and what are they used for. Okay, so to begin, we're going to talk a little bit about what the endocrine system is and then go on to the specific glands and then finish up with the lecture. So let's take a look at our objectives. First one is what is the endocrine system? And I've already mentioned it's a series of glands, and so we have actually two types of glands in our bodies, and we'll discuss that in just a minute. The next thing we're going to talk about are what are hormones, and so we're going to talk about these chemical messengers and then what do they do. And a lot of times they help regulate homeostasis, and again, how to maintain homeostasis is keeping your body in balance. And so we like to think about that in biology. I've brought this up many times before. Biology likes to be even, and the endocrine system plays a major role in keeping your body at an even stasis or an even balance, and we'll talk about that. And then finally, the rest of the lecture, what we're going to look at is what are the major glands found in humans and what do they do. And so kind of give you an idea of where they're located, what's their function, and some of their important attributes of why they're important or why we need to know these things, okay? So to understand what the endocrine system is, it's a system of glands that regulate the body's activities by the release of hormones or through the chemical messengers known as hormones. And you can see on the left or on the right here, we've got a number of different hormone or number of different glands that we're going to look at. And again, a couple of the major ones are found in the center of the brain, and we'll talk a little bit about that. Another one that you may be aware of is the thyroid and the parathyroid, which is the neck, and we'll talk a little bit about those things and what happens when you have dysfunction. The thymus, which is really important really for immunity, but we'll talk more about that next week in the immune system, but we'll look at that as well. You also have the adrenal glands, which sit on top of the kidneys, as well as the pancreas, which is not only a digestive system gland, and we're going to look at that in the next lecture, looking at the digestive system, but it also plays a role as an important endocrine gland. Okay, and then depending if you're male or female, the sex glands, and again, those are important for what types of hormones they produce. If you're female, we talk about things like estrogen and progesterone, and in men, we talk about testosterone, and so we look at these different things. Now, in the endocrine system, it's glandular tissue, and we've already discussed a little bit about glandular tissue. This is that epithelial tissue that we talked about early on in the tissue slides, and we looked a little bit at it. What they do is they regulate homeostasis, again, maintaining the body's balance, and they help regulate metabolic processes. And so you're going to see that they have a lot of different roles. They're not just tied up with one system, but really they regulate all the different body systems. And so we're going to see some of the different roles that they play in. Now, there are two types of glands. There's the endocrine glands, which we're going to really focus in on today. And really the difference between the endocrine glands and the exocrine glands, which are the other types, is that the endocrines secrete directly into the bloodstream. So all these glands here that we're going to talk about today are actually tied into the bloodstream, and what they do is they release the hormones and they go into the bloodstream. Okay? Now the other ones that we have are called exocrine glands, and we talked a little bit about this when we looked at the integumentary system and talked about skin. Sweat glands, apocrine glands, things like that release the sweat and out of the body tend to be exocrine glands. Things that get released out through ducts or pores are exocrine. And so these are a little bit different. So the example we always give are sebaceous glands, the oil glands, or sweat glands. Those are exocrine because they release out into the environment, where the endocrine always are kind of in a closed system because you release it right into the bloodstream, and then the blood takes the hormone to where it needs to go. And so that's the main difference between those. And so what we're going to look at today in the endocrine system are all the glands that secrete directly right into the bloodstream. Okay? So again, we keep talking about these hormones, but what are hormones? Hormones are chemical messengers, and they play a huge role in what they do, okay? Depending on what gland secretes them and where they secrete them and how far or what it does, it can react on several different tissues. We're going to look at the pituitary gland here, which we a lot of times call the master gland, but you can see there are a number of different hormones that the pituitary gland actually secretes and what they regulate. You can see that it affects the adrenal cortex, affects bone and muscle, skin, the thyroid, the testes or ovaries, could be the breast if you're a woman, and the kidneys. And so there's a lot of different hormones that one gland can secrete, and depending on what it needs to do or what type of balance it needs to regulate, it can mean one type of hormone being released at one time and then another one being released at another time. And so again, what hormones are chemical messengers that go throughout the body. Now, again, they control many body processes, and you can see in my picture there's lots of different things that can affect, and it can be produced by one cell that affects others. And again, giving you an example, most of these hormones are produced by the pituitary gland, and you can see these hormones now stimulate other tissue throughout the body. And you can see that there's a typical hormonal balance, that one gland will secrete one thing, and then another one will secrete another in a different response, and they all play together and how they interact and keep that body's balance. That's the real important thing. Okay, and so we can turn them on and off when needed, and so they're not constantly on just pumping out hormones. And again, you guys probably know this by different times in your life and different things that affect. We have stress hormones, we have ones that when you feel good, others when you feel bad, and other things like this. And so we'll look at a lot of these different types of hormones and chemical messengers and when they play roles in the body. Okay, examples of hormones include estrogen, testosterone, thyroxine, and cortisol. And all these are different types of hormones that regulate and cause different things. And again, we're going to look at a number of these different hormones and what they do in the body here in a few minutes. Okay, so the major glands. So the rest of the lecture, I'm just going to spend time on looking at some of the major glands. The first thing I'll point out is where these things are located, and then we'll talk about some of the hormones that they secrete and what they regulate. And so the first one is the master gland, or a lot of times referred to as the master gland because it is the pituitary gland. And this is a bulb-shaped gland that's found really kind of tucked into the brain, and you can kind of see here in the picture that it's kind of tucked at the bottom. It kind of hangs down from the middle of the brain in the hypothalamus, and it kind of hangs down. This pituitary gland has two parts. It has the anterior and posterior pituitary. So it's the master gland. It's found at the base of the brain, and it's controlled by the hypothalamus. The hypothalamus is the part of the brain that regulates a lot of the body's balancing. So it regulates the temperature. A lot of times it will regulate the heartbeat, the blood pressure, things like this. And so the hypothalamus and the pituitary gland work congruently together and try and maintain that body's balance. Now, like I said, there's two parts to it. And again, there's the anterior lobe, which is in the front, and the posterior lobe, which is in the back. And so you can kind of think of whatever way the brain is pointed. And so you always know what way the brain is looking at it by seeing the frontal cortex, which is here. And you always look for, again, either the medulla oblongata, which is down here, or the cerebellum, which is down here. And again, that's the cauliflower shape. And when you see that, you know that's in the back of the head. And so the pituitary gland actually sits kind of in the middle, and the anterior is going to be closer to the front, okay, kind of where you'd see where the eyes would come in, and the posterior is going to be in the back. Now, these guys secrete a number of different hormones, and so including in these include antidiuretic hormone, ADH, and oxytocin. And the anterior also secretes gonadotropic hormone, which stimulates the gonads, prolactin, and growth hormone, which stimulates. And so you can see a lot of these different things and where they react and what they do and the number of tissues they react. And the reason why it's called the master gland is because of all the different hormones that it secretes, because it really has an effect on all the other glands in the body. And so when you release these hormones from the pituitary, you stimulate other glands to produce other things. And so again, we're going to talk about more of the different glands, but the pituitary is probably the most important of all of them because it regulates all the other glands. All right? So the next one is the thyroid, and some of you may have already had to deal with thyroid issues, and we're going to talk a little bit about it. So where is the thyroid located? Well, if you put your hand on your neck, you can kind of feel it. You kind of feel where your larynx is, which is right underneath your chin, and just below that, that's where your thyroid sits. Okay, some of you might have actually kind of a bulge there, and that's due to an increased size thyroid, and some of you might not feel anything there, and that might be a decreased hormone. And we'll talk a little bit about the hypo versus hyperthyroid here in just a minute. This is technically the largest gland because it does sit very large in the neck. It's found in the center of the neck between above the trachea, okay? And it produces a number of hormones like the pituitary gland. But the two that are really important are the thyroxine, which regulates the metabolism and weight loss. So people will say, you know, if I have hyperthyroid, I produce too much thyroxine, and so that's the people, if you're in a hyper situation, those are the people that can't gain any weight. They have this super fast metabolism. Everything they eat, they burn off right away, and they do have very significant weight loss issues and some other issues that we'll talk about. The hypothyroid, what a lot of people have in common, is when your metabolism slows down. This is where the thyroid doesn't secrete as much thyroxine, and so what happens is that your metabolism actually comes to a complete stop. Again, what you see is significant weight gain associated with this. This is what Oprah always uses as her claim. Well, she has a, hypothyroidism. That's her problem, why she can't lose the weight, or she gains a lot of weight, or she has these ups and downs. And again, it can play a role in that and everything else. And sure enough, they do have medications that can help you regulate these things. And so we'll look at some of these things in just a minute. The other one that is secreted by the thyroid is this calcitonin, and that basically regulates the amount of calcium you have in the blood. And this is especially important when we get older, when we worry about calcium and how much calcium are going to our bones and how much gets pulled from our bones and that stuff. And so we look at our calcium levels to see how well our thyroid is working. So again, those that suffer from things like osteoporosis and other things like this may have an increased amount of calcium in the blood because it's actually pulling the calcium away from the bones and weakening the bones. And so we'll look at that again when we look at the skeletal system and other things that play a role. Now, I did bring up this hypo versus hyper, and you can see some of the different things that you might have. Now, I wanted just to bring this up. Now, I don't want you to go rushing off to your doctor and saying, I think I have hyperthyroid or hypothyroid, but this can kind of tell you some of the things that you might be experiencing. So if you have very dry hair, a puffy face, a slow heartbeat, weight gain, constipation, brittle nails, arthritis, cold intolerance, depression, dry skin, fatigue, and this kind of fits in with a lot of different things. But if you have a number of these symptoms that you see up here, you might want to go get your thyroid levels checked out and see if you have an issue. Also, under the other condition you can have, you can produce too little, the hypo, or you can produce too much, the hyper. And in that situation, you get hair loss, you get the bulging eyes. You really see it in people that suffer from Graves' disease. And Graves' disease is actually a disease of the thyroid. And a lot of times you see it where they have the real bulging eyes, and people, you can see them when they open their eyes, they seem like their eyeballs are going to pop out of their head. That's a real dead giveaway of hyperthyroidism. Another thing is very quick weight loss, very, very skinny. Again, you have rapid heartbeat, regular gas, soft nails, sleeping difficulties, heat intolerance. You have infertility, muscle weakness, nervousness, and other things that are associated with these things. So again, if you have more than one of these symptoms, you might want to get your thyroid levels checked and see if you have maybe hypo or hyperthyroidism, and see if maybe that is an issue that you're dealing with. Okay? So another gland is a parathyroid gland, and the parathyroid gland actually sits in the thyroid. We actually have 4 of them in our thyroid, and 2 of them sit at the top on either the left or right sides, and the other 2 sit at the bottom. Okay, and they're in the posterior, so in the back of the thyroid. So they're actually closer to the trachea than they are sticking out, type of thing. Okay, They have a couple of different hormones associated in them. The first one is the parathyroid hormone, which regulates, again, the amount of calcium in the blood. So what this hormone does actually increases the amount of calcium reabsorption, vitamin D and that stuff into the blood and reabsorption into the bone. So the more parathyroid hormone, it stimulates the blood to actually force the calcium to be absorbed into the bone. However, calcitonin, which is produced to the thyroid, decreases the amount. And so again, it's this yin and yang type of thing. And so sometimes you need more calcium, other times you need less. And so again, if you're having issues with osteoporosis and things like this, that can be an issue due to your thyroid and then anything else. And so we'll look at these things and saying how much or how little they come into the things. And so again, you have multiple glands doing the same types of things, and it's all about maintaining balance. So you see some that increase, some that decrease, and that's just giving you an idea of some of these things that happen. Okay. Another one that's really important is the adrenal gland. The adrenal glands sit on top of the kidneys. They're kind of like the little cap that sits on top of the kidney. And what they do is they produce steroids. They help reduce inflammation when your body has inflammation in the body. And so sometimes if you have a really bad cold, or sometimes if you have a really bad allergy outbreak, they'll give you steroids. Steroids are actually produced by the body that helps reduce inflammation and actually helps you feel better. However, it also has an effect on your immune system. Okay, can affect metabolism. So people that do take steroids, a lot of times what you see is if they're on steroids for a long time, they actually kind of bloat up, and you kind of see it in their face and in their body. They actually retain water, they retain the fat and things like this, because your body is going into like almost like a starvation mode and starting to store things. Okay. The other thing that is produced by the adrenal gland is adrenaline, and adrenaline is the fight or flight mechanism, and a lot of you guys know what that is. That's basically where, you know, you get so scared, and a lot of you guys like to go see scary movies. You get so scared because you get that adrenaline pumping that either you stay there and you fight, or you take off and run. And basically what it allows you to do is get your body to run away or protect itself. And so obviously the fight or flight, this, you know, breathing becomes faster, your heartbeat becomes stronger, your blood pressure increases, your muscles tense up, ready to fight, your hands and feet come cold and sweaty, and that's because the blood's getting back to the heart faster. And you feel it in your mouth. This is like when you have to go and give a speech in front of class or something. A lot of times this happens and you get sweaty and, you know, and everything else. And that's the adrenaline being released. And sometimes, you know, we do this artificially by, you know, getting ourselves scared or worked up or something like this. And some people thrive on that adrenaline. And so that, again, is produced by the kidneys, or by the adrenal gland, which sits on top of the kidneys. Now, the hormones that it produces is aldosterone, which involves kidney absorption of the potassium and sodium in the kidneys, and then cortisol, which is, again, an important blood glucose level. It keeps the blood glucose levels in check, helps metabolize muscle proteins and amino acids and break down of fatty acids. And so one of the drugs that people are now taking are drugs that block cortisol. And so you might see these on these infomercials saying, oh, you know, if you you want to lose weight by taking a pill. A lot of times what they do is they target this cortisol, which is, again, regulating blood sugar and doing that. And again, it speeds up or slows down metabolism in a way. And so if you take these drugs, sometimes you can block these things. Okay. The next one is the pancreas. Now, the pancreas is kind of located behind the stomach and kind of situated in between the small intestine, the first fold of the small intestine. And really what these things are made up, if you ever looked at a pancreas and you looked at one in the frogs and that stuff, you can kind of see that it's kind of this bulbous material. It's got a lot of these bulby, or kind of almost like the popping, the material, the packing material that you pop and that stuff. It kind of looks like that. And the reason why it looks like that is because the cells are grouped together, and what these things are called islets, and so or isolates. Okay, and so they have these things, these isolates, that basically are where the pancreas makes insulin, and so we have these different cells. One of the things that it makes is glucagon, and glucagon is sent to the liver to break down glycogen into glucose. When the body needs more carbohydrates to function, it sends this hormone to the liver to say, okay, let's break down the glycogen that you've stored and make more glucose, so I have it to do cell function. Another, and obviously the most important one, is insulin. And insulin causes glucose to be taken out of blood. So when you have more insulin in your body will pull the glucose out of the blood and metabolize it. Okay, without it, glucose levels start rising, and that causes circulation issues and leads to the disease known as diabetes. And we'll talk a little bit more about this. And you can kind of see, here's the islet cell of the pancreas, and you can kind of see that it's made up of this group of cells, and then they secrete into the bloodstream. And again, what happens is these cells release insulin into the blood, and then the blood will bring in glucose or pick up glucose and bring it into the muscle. So when insulin is there, it tells the blood, okay, you have too much glucose, time to get the glucose out of there so that we can use that glucose to use it for cell respiration. And so that's typically how the system works. However, if you have some type of insulin resistance, and again, we'll talk about that in a minute, you can develop this condition known as diabetes. And so a lot of people ask, what is diabetes? Well, there's really two types. There's the first type, type 1, which is caused by a genetic mutation or an autoimmune disorder. And essentially what it is that either you've never made insulin in your life because your genetic makeup says that your insulin is mutated and you don't make it, or your immune system itself goes and attacks the pancreas and stops the production of insulin. And so sometimes this can happen and you develop what is called type 1 diabetes. And so essentially what a type 1 person is a person that doesn't have insulin. And so these are the people that either take pills or shots to regulate the amount of insulin that they have. Okay, these are the ones that you have to worry about because, again, you release a lot of glucose into the body, glycogen and protein breakdown causing ketoacidosis. The muscle is unable to use glucose because the insulin is too low. And so what happens is you get decreased insulin in the blood vessels, increased glucose in insulin, the muscles can't break it up, and then the glycogen itself keeps breaking down more and more glucose, and so that can lead to serious problems. The second type is type 2, and this is where insulin is actually made. You don't have a genetic mutation and your immune system is not attacking it, but what happens is the insulin is no longer recognized. And that's because you flood the system with so much sugar all the time. It's drinking these the big 32-ounce Cokes and eating the high sugar McDonald's all the time and that stuff. What you do is you have so much sugar in your body, so much glucose, that there's not enough insulin to get all that glucose out. And so what happens, you end up getting more glucose into the bloodstream. The muscle is unable to use that glucose because of the insulin resistance, because it doesn't have enough insulin to do it. And again, what causes these things? Obesity is a big issue. So again, if you're overweight and getting morbidly overweight, that can be an issue. Again, inheritance can be an issue there too, where people have it. And a lot of times people, if they just fix their diet, can regulate it without having to take insulin. Because once you've dropped the levels of glucose and eat healthier and eat better, your body starts to respond and it recognizes the insulin again. It's because you're not flooding the system with glucose all the time. And so type 2 is very easily treated just with diet alone. In those most serious cases where their blood sugar levels are so high or they have these ups and downs that are so high, that's when you have to go on insulin because you need more insulin to get the sugar out of your body. Now, a lot of times what happens as soon as people change their diets in the type 2, they go off the medication and they feel a whole lot better. So if you're in that situation or you're in a situation called pre-diabetic, the biggest thing you can do is change your diet and get that amount of glucose down so that your body can handle all the glucose that's in your blood. Okay, and so that's a big thing. If you're a type 1, obviously it's a lot more difficult because you have some either genetic disorder where the insulin is not made or your immune system is attacking your pancreas and destroying all your insulin cells, insulin producing cells. And so that's obviously a much bigger issue to deal with. Okay, so that's what diabetes is, type 1 and type 2. Now another gland is the pineal gland, and the pineal gland actually sits in the back of the brain. Well, a lot of times we refer to this as the third eye. So you hear these stories about people having that sixth sense or the third eye. Why we call it the third eye is because this gland regulates our sleep cycles, okay, our deep sleep cycles, and regulates our circadian rhythms. You may have heard these things, and so it relates to our when we wake up and when we go to bed. And again, the two things that it secretes are the one thing that it secretes is melatonin, and this is the production of hormone that regulates the day and night cycles. And so when you get closer to nighttime and it gets darker out, your body starts producing melatonin, and the melatonin gets your body to quiet down and slowly go to sleep. However, in our day and age, with so many electronics, so many things that are hitting us, the stress of our jobs, we have now screwed up our melatonin regulation and that stuff, and people are not getting good nights of sleep anymore. And so this can be a real issue, and this is all due to the little pineal gland that's in the back of the brain. Okay, and so again, what this does is it regulates the melatonin and cortisol. Cortisol is secreted to wake you up, and then it slowly goes down during the day, and as at night, melatonin comes in so that you have a nice sleep type of thing. The problem is now a lot of these electronics that we use to show this light, and what it does is this blue light, and you've heard this before, this blue light actually suppresses your ability to release melatonin. So if you're one of those people that take your phone to bed with you or watch TV before you go to bed or one of those things, a lot of times you suffer and it makes you fall asleep, or makes you have a tougher time falling asleep, and because it affects your melatonin levels. Now sometimes you might be so tired from the day it doesn't matter. You could have the TV going full blast and you'd still fall asleep. But what I'm really talking about is if you have a regular sleep schedule, and a lot of times you find that you have a hard time getting to sleep, maybe what you should do is put down the phone a half hour to an hour before you go to bed and just kind of have a nice quiet time so that your brain can really produce the melatonin and get you to fall asleep faster. Okay? And again, there are some drugs and herbals out there that you can actually take that can actually affect the melatonin levels and that stuff. And again, another big thing is stress, and we all have stress in our lives. And again, figuring out how to regulate that can also help you have a better night's sleep as it goes. Okay? All right, another gland that we're going to talk about next time is the thymus gland. So next week we're going to talk a lot about the immune system. Now this is kind of located in between your lungs and your heart. So it's kind of near the center of your chest. And it's really involved in the immune system. This is where your T cells go and actually mature. And when you're a child, it's very large. You have a very large thymus gland, but as you hit puberty, this gland gets smaller and smaller and smaller. And it may be the reason why we get weaker and weaker immune systems as we age, because this gland gets smaller and smaller. Less T cells for our bodies to regulate, things like that. And so that may be an issue. And again, we're going to talk about this gland more next week with the immunity. And so save that thought for there, but that is an important one for the immune system as well. Okay. The last two that I'm going to talk about are the sex glands. And so if you're a woman, you have ovaries. Okay. And the ovaries are found in the lower abdomen. They regulate the production of estrogen and progesterone, especially during the times of menstruation, and again during the ovulation cycle. And so estrogen and progesterone are two hormones that we're going to talk about again when we look at development and in the sex, in the reproduction parts. And again, these have a very important role of when you ovulate and when you have your menstrual period and things like this. And so we'll talk more about this. It's also responsible for the ovulation and things like that go on. And again, stimulates a lot of things that happen during puberty. So the growth of breast and in the higher voice and things like this, the estrogen that gets produced, these are all due to the sex glands. In men, what you have is the testes, and the testes are responsible for producing testosterone. Again, these are found in the testes. The testes not only make the sperm, but they also produce the testosterone, which again give a lot of the features that men see once they hit puberty. The growth of body hair, the deepening of the voice, the quick growth in their bodies and things like this, the muscles and things like this. And again, the testosterone is a very important part that regulates the production of sperm, and again plays a huge role in the production of sperm and then also making offspring. And so we'll look at these types of hormones again when we get into the reproduction chapter in 2 weeks. I know you're excited about it, but we'll see this and revisit this again in about 2 weeks when we look at these things. All right? And so we've come to the end of the lecture. Just want to summarize. And again, the endocrine system is a series of glands that regulate and affect other body systems. So that's one of the things. Again, endocrine secrete into the bloodstream, exocrine out of the body. Okay. Hormones are the chemical messengers that were released in the bloodstream that have effects on tissues and organs. And again, the thing that we want you to know, where are they found? So the major glands, where do you find them? Typically in the brain and associated with other organs. found throughout the body, and what you see is that they affect the metabolism, growth, regulation of nutrients in the blood, and the reproductive cycles in humans. And so really they play a huge role in maintaining that balance in the human being. Okay, and with that, we've come to the end of the lecture. If you have any questions, please ask me or Miss Jill about any of the questions that you might have. Send me emails and all those things. Again, this is more of an informational type of thing. You're going to see this again, especially if you go on and take A&P, so you might as well look at these things and get an idea of what they do now and do really well in this part of the biology. Okay, so thanks for watching, and I'll see you next time.